The nurse cares for a patient hospitalized for 5 days with pneumonia. He is about to be discharged and the nurse is providing discharge instructions to the patient and the family. Which statement made by the patient's family should most concern the nurse? A. He can stop taking the antibiotics when the symptoms are gone. B. He still has to use the incentive spirometer to keep his airways clear and open. C. He can eat normally but we have to make sure he has a nutritious diet. D. He can start doing his chores when he feels better, but shouldn't overexert himself and should rest a lot. E. He should stay away from other sick people because his immune system is still weak. The answer is A. He can stop taking the antibiotics when the symptoms are gone. When a patient has an infection and is prescribed antibiotics, the patient should always take the full course of the medication and never discontinue the medication. It is easy for patients to believe they can stop taking the medication when the symptoms are resolved, but the nurse needs to educate the patient to continue the full regimen. The rest of the statements are accurate. The patient must get adequate rest, eat well, use the incentive spirometer, and stay away from others who are sick until he is well. A 2+ radial pulse is considered to be dash. A. A normal pulse. B. A bounding pulse. C. An absent pulse. D. A weak pulse. The answer is A. A normal pulse. The following scale applies to the amplitude of a pulse when palpated at the radial artery. 3+ is an increased or bounding pulse, 2+ is a normal pulse, 1+ is a weak pulse, 0 is an absent pulse. Which of the following locations is most appropriate for assessing the pulse of an infant? A. Carotid artery. B. Brachial artery. C. Radial artery. D. Popliteal artery. The answer is B. Brachial artery. The most appropriate location for assessing the pulse of an infant is the brachial artery, which travels from the axilla down the ventral surface of the upper arm to the cubital fossa. The popliteal and radial pulses are difficult to palpate on an infant due to their size, and the carotid artery can be difficult to palpate due to an infant's shorter, thicker neck. Which of the following is a normal adult respiratory rate? A. 11 breaths per minute. B. 9 breaths per minute. C. 16 breaths per minute. D. 22 breaths per minute. The answer is C. 16 breaths per minute. Normal adult respiratory rate is 12 to 20 breaths per minute. A respiratory rate below 12 is defined as bradypnea, while a respiratory rate above 20 is considered tachypnea. What is a normal respiratory rate for an infant under 1 year of age? A. 30 to 60 breaths per minute. B. 20 to 30 breaths per minute. C. 10 to 20 breaths per minute. D. 60 to 90 breaths per minute. The answer is A. 30 to 60 breaths per minute. Infants have the highest respiratory rate of any age group. A normal infant respiratory rate is 30 to 60 breaths per minute. How might an overlarge cuff affect your blood pressure reading? A. The reading would be artificially low. B. There would be no significant effect. C. The reading may be unstable. D. The reading would be artificially high. The answer is A. The reading would be artificially low. An overlarge blood pressure cuff will often result in a blood pressure reading that is artificially low. It is important that the nurse chooses the appropriate blood pressure cuff size for each individual patient. While assessing a patient's blood pressure, what part of the stethoscope should be placed against the patient's antecubital fossa, the bell, or the diaphragm? A. The diaphragm. B. The diaphragm should be used first, then the bell. C. The bell. D. The bell should be used first, then the diaphragm. The answer is A. The diaphragm. When taking a patient's blood pressure, the diaphragm alone should be used to listen at the antecubital fossa. The bell, used for low-pitched sounds, would not give the examiner accurate enough information to assess systolic or diastolic pressure. Which of the following would be considered a normal adult blood pressure? A. 124/84 millimeters of mercury. B. 88/56 millimeters of mercury. C. 110/72 millimeters of mercury. D. 132/88 millimeters of mercury. The answer is C. 110/72 millimeters of mercury. Normal adult blood pressure is anywhere from 90 to 120 millimeters of mercury systolic over 60 to 80 millimeters of mercury diastolic. 120 to 140 millimeters of mercury over 80 to 90 millimeters of mercury would be considered prehypertension, while anything over that would be considered either stage I or stage II hypertension. What is a normal respiratory rate for a child aged 1 to 6 years old? A. 34 to 44 breaths per minute. B. 12 to 24 breaths per minute. C. 36 to 54 breaths per minute. D. 24 to 34 breaths per minute. The answer is D. 24 to 34 breaths per minute. A normal respiratory rate in a child aged 1 to 6 years is 24 to 34 breaths per minute. This is significantly higher than an adult normal respiratory rate, which is 12 to 20 breaths per minute. What is a normal heart rate for an infant under 1 year old in beats per minute, BPM? A. 160 to 240 BPM. B. 100 to 160 BPM. C. 60 to 100 BPM. D. 30 to 60 BPM. The answer is B. 100 to 160 BPM. Infants have the highest heart rate of any age group. Normal heart rate for an infant under 1 year of age is 100 to 160 BPM.